Hi, my name is Yuliya Vinnitska, and I'm a registered nurse at Sarasota Memorial Hospital. I will be speaking about type 2 diabetes mellitus, and we will go in depth to understand this specific disease process and apply it to our nursing practice.
Definition and objectives. Type 2 diabetes is a chronic condition that affects how your body metabolizes glucose. In this condition, either the body does not produce enough insulin or the cells become resistant to insulin, preventing glucose from entering the cells effectively. This results in elevated blood sugar levels. The objectives for this slideshow are the impact on the population, etiology and risk factors, pathophysiology, clinical manifestations and complications, treatment, and nursing evidence-based practice. Impact that diabetes type 2 has on the U.S. population. To start off, we will look at Figure 1, statistics. About 38 million people have diabetes. That's about 1 in every 10 people, and 1 in 5 people don't even know they have diabetes. This information was found from Centers for Disease Control and Prevention. Type 2 diabetes is a significant public health concern in the U.S., affecting millions and contributing to considerable morbidity and economic burden. Ongoing public health initiatives focus on prevention, early detection, and effective management to address this growing epidemic. As of 2022, approximately 38 million Americans have diabetes. That's about 11.3% of the population. And the majority of these Americans have type 2 diabetes. The prevalence increases with age, particularly among those over 45 years old. Although increasing numbers of children and adolescents are being diagnosed due to rising obesity rates. In recent years, about 1.5 million new cases of diabetes are diagnosed annually in the U.S. Diabetes is listed as the 8th leading cause of death in the U.S. in 2021. It can lead to complications that contribute to mortality, such as cardiovascular disease. People with diabetes often have a reduced life expectancy. Estimates suggest that they may live on average 6 to 8 years less than those without diabetes. Many individuals with diabetes face long-term complications that can significantly increase healthcare costs, including hospitalizations and long-term care needs. The average medical expenses for individuals with diabetes is about $16,752 per year, with about $9,600 of that attributed directly to diabetes-related expenses. Etiology and risk factors. First, we have modifiable, and second, we have non-modifiable. Diabetes type 2 is characterized by insulin resistance and relative insulin deficiency. The etiology involves factors of genetic, environmental, and lifestyle factors. Genetic predisposition plays a big role, with numerous genes influencing insulin secretion and action. Obesity is a major contributing factor as excess fat tissue releases free fatty acids and inflammatory cytokines, which impair insulin signaling. Sedentary lifestyles and poor dietary choices, such as high consumption of carbohydrates and sugars, further exacerbate insulin resistance. Additionally, age is a factor. The risk of developing diabetes type 2 increases with old age due to lifestyle factors and changes in body composition. Hormonal changes, particularly those related to stress and sleep disturbances, also contribute to the development of insulin resistance. Modifiable risk factors of diabetes mellitus are obesity, physical inactivity, unhealthy diet, smoking, hypertension and dyslipidemia, and gestational diabetes. To start, obesity, because excess body weight, especially around the abdomen, significantly increases the risk. Physical inactivity, a sedentary lifestyle, contributes to insulin resistance. An unhealthy diet, a high intake of processed foods, sugary beverages, and low fiber consumptions can elevate risk. Smoking, tobacco use is linked to increased insulin resistance and higher risk. Hypertension and dyslipidemia, poor management of blood pressure and cholesterol levels can increase risk. Gestational diabetes, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later. Non-modifiable risk factors are age. The risk of type 2 diabetes increases with age, particularly after age 45. Genetics. Family history of diabetes can significantly increase an individual's risk. Ethnicity. Certain ethnic groups such as African Americans, Hispanic Americans, and Native Americans have higher predispositions to DM2. Gender. Although both men and women can develop type 2 diabetes, men may be at a slightly higher risk, especially when considering body fat distribution. Moving on to pathophysiology. In Figure 1, we can see all things that are leading to increased blood glucose. If we have increased carbohydrate intake, we have decreased peripheral glucose uptake, we have decreased insulin secretion and increased hepatic glucose production, all leading to increased blood glucose from Figure 1. The pathophysiology of type 2 diabetes involves a combination of insulin resistance and impaired insulin secretion. At first, the body's cells become less responsive to insulin, a hormone that facilitates glucose uptake from the bloodstream. This insulin resistance is primarily influenced by factors such as obesity, visceral fat, which releases free fatty acids, and inflammatory cytokines that disrupt insulin signaling pathways. As insulin resistance progresses, the pancreas attempts to compensate by producing more insulin. However, over time, the beta cells in the pancreas may become dysfunctional and fail to produce adequate insulin to meet the body's needs. This leads to elevated blood glucose levels, resulting in hyperglycemia. In addition to these mechanisms, the liver also plays a crucial role. There is often increased hepatic glucose production due to reduced insulin signaling, further exacerbating hyperglycemia. Chronic hyperglycemia can result in various complications, including cardiovascular disease, neuropathy, nephropathy, and retinopathy. Factors of genetic predisposition, lifestyle factors, and hormonal changes creates a complex metabolic environment that underlies the development and progression of type 2 diabetes. Now we are talking about clinical manifestations and complications. Type 2 diabetes presents with various clinical manifestations and can lead to significant complications if not effectively managed. Clinical manifestations are polyuria, increased urination occurs at the kidneys and they excrete excess glucose. Polydipsia, increased thirst results from dehydration caused by fluid loss. Polyphagia, increased hunger may occur despite high blood sugar levels due to cellular starvation. Fatigue, insufficient glucose uptake by cells leads to decreased energy levels. Blurred vision, elevated blood sugar can cause temporary changes in the lens of the eye. Slow wound healing, poor circulation and nerve damage can impede healing. Skin changes, dark patches can appear, particularly in areas of skin folds. Type 2 diabetes affects many major organs, including the heart, blood vessels, nerves, eyes, and kidneys. This disease can lead to many complications. First, I'll start with acute complications, and then I will talk about chronic complications. Acute complications include hyperglycemic hypersmolar state, HHS, characterized by extremely high blood sugar levels, dehydration, and altered consciousness. Another acute complication is diabetic ketoacidosis. Although it's more common in type 1 diabetes, it can also occur in type 2, especially in stressful situations, resulting in acidosis. These stressful situations can stem from being in a hospital setting. Chronic complications: cardiovascular disease, increased risk of heart disease and stroke due to damage to blood vessels. Neuropathy, nerve damage can lead to numbness, pain, and weakness, often starting in the feet, known as peripheral neuropathy. Nephropathy, kidney damage, can progress to chronic kidney disease and may require dialysis. Retinopathy, damage to the blood vessels in the retina, can lead to vision problems or blindness. Feet problems: poor circulation and nerve damage can lead to ulcers and infections, sometimes resulting in amputations. Skin complications: increased susceptibility to infections and skin disorders. Type 2 diabetes can be diagnosed by the A1C test, also known as glycated hemoglobin test. This test indicates your average blood sugar level for the past 2 to 3 months. Results are read as follows. 5.7% is normal. 5.7 to 6.4% is diagnosed as prediabetes. 6.5 or higher on 2 separate tests indicates diabetes. Moving on to very important topic of diabetes, which includes treatment. The treatment involves a multifaceted approach aimed at managing blood glucose levels, minimizing complications, and promoting overall health. Here are the primary treatments. Lifestyle modifications include dietary changes. A balanced diet and rich whole grains, fruits, vegetables, lean proteins, and healthy fats is important. Monitoring carbohydrate intake and portion sizes helps to regulate blood sugar levels. Physical activity: regular exercise, at least 150 minutes per week, improves insulin sensitivity and helps with weight management. Activities can include walking, cycling, swimming, or strength training. Weight management: achieving and maintaining a healthy weight can significantly improve blood sugar control and reduce the risk of complications. Medications: oral hypoglycemics is what we will talk about first. So, first is metformin. This is often the first-line treatment that helps improve insulin sensitivity and reduce liver glucose production. Sulfonylureas are medications that stimulate insulin secretion from the pancreas. An example is glipizide. We also have GLP-1 receptor agonists. These are injectable medications that slow digestion and help lower blood sugar levels. Examples are semaglutide or Ozempic, a medication that is very popular on the market currently. We also have SGLT2 inhibitors. These help the kidneys remove excess glucose through urine. Examples are Farxiga and Jardiance. Another medication is insulin therapy. In some cases, insulin may be necessary, particularly if blood glucose levels remain high despite oral medications. Insulin plays a crucial role in regulating glucose. Insulin is secreted by the pancreatic beta cells in response to elevated blood glucose levels. It facilitates the uptake of glucose into muscle and fat cells by binding to insulin receptors. activating signaling pathways that promote the translocation of glucose transporter proteins to the cell membrane.
Nursing evidence-based practice. One key organization that provides valuable recommendations for nursing care related to type 2 diabetes mellitus is the American Diabetes Association, ADA. Their guidelines emphasize a comprehensive, patient-centered approach to diabetes management, which is crucial for nurses to implement in clinical practice. Their publication, Management of Hyperglycemia in Type 2 Diabetes Mellitus, discusses important recommendations and outcomes. They talk about individualized care plans. Nurses should develop care plans tailored to each patient's needs, preferences, and culture background. This personalized approach helps improve patient engagement and adherence to their treatment plan. Education and self-management support. The ADA stresses the importance of providing patients with education on diabetes self-management, including blood glucose monitoring, dietary choices, physical activity, and medication adherence. Nurses play a vital role in delivering this education and reinforcing it during follow-up visits. Regular monitoring and assessment. Continuous monitoring of blood glucose levels and A1C is recommended. Nurses should ensure that patients understand how to monitor their blood sugar and recognize signs of hypo and hyperglycemia. Behavioral interventions. The ADA advocates for integrating behavioral health strategies into diabetes care. Nurses can facilitate access to counseling or support groups to address mental health issues, such as depression and anxiety, which often accompany chronic conditions like type 2 diabetes. Comprehensive foot care. Regular foot assessments are essential for preventing complications. Nurses should educate patients about daily foot care and the importance of regular foot exams, especially for those patients with neuropathy. Interprofessional collabs. The ADA encourages collaboration among healthcare providers to ensure comprehensive care. Nurses should work closely with dietitians, endocrinologists, and other specialists to optimize patient outcomes. Implementing these recommendations can lead to improved glycemic control, reduced complications, and enhanced quality of life for patients. Evidence suggests that effective diabetes education and self-management support provided by nurses significantly improve patient outcomes, including better adherence to medication and lifestyle changes. Overall, the adherence to the ADA guidelines ensures that nurses play a pivotal role in the multidisciplinary management of DM2, ultimately leading to better health outcomes for patients. And I will leave everyone with my references.